So you've had a vaginal birth, or you're planning to go ahead and have a vaginal birth, and you're wondering how to ensure that you're healing well after you give birth. Well, in this video, I'm going to give you 5 important aspects or tips on how you can recover well after a vaginal birth. So stay tuned till the end. And yes, hi, I am Saranya, the founder of Babypedia. I'm a pregnancy coach and a life coach for mothers. So first, let's just jump into the tips. Tip number 1, let's discuss episiotomy or stitches in your vagina that are given by a lot of care providers during a vaginal birth. So even if you don't have the stitches in your vagina, or what we call as an episiotomy, your perineum, your vaginal muscles are going to be sore. It is going to be difficult for a few days. Whenever you're sitting, you may feel a little bit of pain. So just follow the tips that I'm going to tell you to take care of your episiotomy. If you want a very detailed video on how to take care of the episiotomy, I'm going to link it down in the description so you can look into it. Okay. So this episiotomy is going to take a couple of days to heal. Sometimes it can be a week. For others, it can be a little longer than a week based on how long it is, the number of stitches, and the amount of, healing that has to happen. So ensure that when you're sitting, if it's very uncomfortable, you're using a donut pillow or you're rolling a blanket in the shape of a donut so that your perineum or your vagina is not pressed against when you're sitting to breastfeed, so you're able to sit for long periods. You can look at other options of breastfeeding, like lying down sideways and breastfeeding your baby, and also ensure that the vaginal area is as dry as possible. Yes, I know it's not going to be feasible, especially since you will be bleeding for at least 30 to 45 days after you give birth, but change your pads often and air dry whenever possible. Always wash the area and wipe it before you're wearing your pad to ensure that you're reducing the chances of an infection. Okay. And you could also try having a SIDS bath, that is, fill a bowl with warm water with a little bit of Epsom salt or a little bit of betadine, whatever your doctor has recommended, and dip your perineum or the stitches into it. Okay, you can put it on the toilet seat and you can sit, put it on a chair and you can sit, whatever is comfortable, and let your stitches soak in the warm water. This is going to increase the blood flow and facilitate healing. It's going to reduce the chances of infections. Okay, so now the second thing that you will have to focus on is your movement. Okay, yes, it's going to be difficult to walk after you've just given birth, but then the earlier you move, the easier your recovery is going to be, especially if you were given epidurals or any pain medication for your spine where, the lower part of your body, you were losing a little bit of sensation, the pain was less, then it is recommended that you start walking as soon as your doctor asks you to. The feeling of that, the anesthesia will become lesser after a few hours. You will be able to move your feet, but don't get up immediately without getting the okay from your doctor. Once your doctor comes, checks you and asks you to walk, please try to walk, because when you are lying down, it increases the chances of you getting blood clots, okay, which can sometimes, very, very, very few times, it can cause complications. So that is why if you get down and you start walking as soon as possible, it is going to reduce the chances of you getting blood clots in your lower part of the body. It is going to ensure that you're recovering faster, blood flow is resuming well, digestion is resuming well. So, you're feeling more like yourself sooner, okay? So try to walk. You don't have to walk very fast. You don't have to walk the entire length of the hospital corridor. Even if you're taking just 10 steps and back again every time you get up to breastfeed your baby or get up to use the restroom, that itself is good. You can slowly increase the amount of walking that you're doing as days pass, right? The third thing is the type of food. So see, when you give birth, especially vaginally, it takes a lot of energy. Yes, so you may feel exhausted, you may feel hungry. So start off with simple food. Okay, simple, home-cooked, easy-to-digest food. Even if you're not able to get home-cooked, you have to get it from the hospital cafeteria. Then don't worry, get simple food that is easy to digest. This is because, during birth and during pregnancy, all your organs are all pushed in different places. Your tummy, your stomach all has to get back and digestion has to kickstart again. And a lot of mothers will complain of getting constipated after giving birth, okay, even if you did not have it during pregnancy. So please try to have easy to digest food. Include a lot of fiber, food that is rich in fiber like vegetables and fruits, so that you don't get constipated and your first poop after you give birth is easier for you. You don't have to go strain. And then slowly as the days go, you can increase the different types of food that you're eating. But then there is no particular restriction for any type of food except half-cooked or uncooked food. Okay. Now the fourth thing is your tummy. Even though you've given birth vaginally, your tummy is going to be a little big and loose, okay, because your uterus took 9 months to expand to that size. So it's not going to go back to its pre-pregnancy size within a few hours. It's going to take at least 30 to 45 days for your tummy to go back to its pre-pregnancy size. So soon after you give birth, the shrinking has already started. But your tummy could be a little big because your uterus is still big. Give it some time. Okay, don't feel the pressure of starting exercising immediately. Give it some time. As you start healing, days pass, your tummy will start to go in. Now, to support that flab, that looseness, because when you're lying down, you want to turn around, change positions, your tummy can be loose. It can cause a lot of discomfort for you. You can tie your tummy or use a belly binder. It can be a belt, it can be a sari or a dupatta or a long cotton cloth that you have that you can use to bind your tummy. Now, this is not going to make your tummy flat or reduce your tummy. This is just to give a little support to your abdominal muscles till they regain their strength. So don't wear the belt or, tie your tummy 24/7. Just do it for a few hours every day. So 2 hours in the morning, 2 hours in the evening. It shouldn't be too tight. You should be able to sit a little comfortably and breathe, because when it's too tight, it's going to put pressure on your diaphragm. That is, the set of muscles that's below your lungs, and also more pressure on your pelvic floor muscles, which can actually cause weaker pelvic floor muscles and more complications. Okay, so it should be a little tighter than what your normal size is. Not too tight that you can't breathe. You should be able to breathe well. And after a few hours, just remove it. Do not wear it when you're sleeping. Do not wear it when you're eating. Okay, this is very important tips. Now, finally, let's look at exercising. Though, healing after a vaginal birth is quite easy, don't jump into exercising. Yes, you can slowly start to walk as soon as you feel better. Start with 5 minutes and then 10 minutes. Do it slowly and then increase the speed as and when you feel comfortable. But wait till at least 45 days before you start mainstream exercising. Go for your checkup, meet your doctor, check whether your stitches have healed well. And once it has healed well and your doctor has given the go-ahead, start with very mild stretches. And then slowly, as you're feeling comfortable, increase the intensity of your exercises. Remember, exercising is what is going to help your tummy to go inside and your uterus to shrink even better. So please ensure that you are exercising after 45 days after getting the clearance from your doctor. So I hope these 5 important factors gave you a lot of information on recovering better after birth. Take care. If you have any doubts, please feel free to post it in the comments below. I will answer it, and take care. I will see you soon in another interesting video. And before I go, don't forget to like this video, share it with another mother who is pregnant, and subscribe to the Babypedia channel for more information on trying to conceive, pregnancy, birth, early parenting, and much more. I will see you soon. This is Saranya. Till then, bye-bye.